And you stand wide.
넓게 서시고
Exactly. And then you bend to one side
한쪽으로
and to the other side.
다른 쪽으로
It's okay. Does it hurt?
여기
Other side?
반대쪽은요?
Does it hurt like this?
근데 둘 다 스트레칭 될 때 아픈데 여기는 굽힐 때
여기는 굽힐 때가 다 보고
굽힐 때도
when she tries to stretching, it's the same pain is in both sides, but she can feel the more pain bent to right side, right pain.
When you go right, you have the pain on the right side.
오른쪽 갈 때 오른쪽으로.
여기
Yes, yes.
Okay. And during the day, you have more pain on the left or on the right side?
평상시에 어디가도.
On the right side. Okay. So, if you go to the left,
왼쪽으로
you feel this pain or not?
통증 좀 있나요?
Yes. And if you go to the right, you feel it also?
그래도
Also. Okay. This is not typical, but it happens, and it very well that we can show this. Most often, the provocating maneuver is just the bending to the opposite side. This gives a stretch on the muscle, and this reproduces the problem. And if you bend to the other side, normally it doesn't hurt, but it can hurt. Why? If we have a look at this situation, I need again this paper roll. This was an excellent.
일단 이렇게 양쪽 양쪽으로는 자기진단을 하면 가능성은 있습니다. 보통은 어떻게 되냐면은 이쪽으로 보면 반대쪽 스트레칭 되면서 나오는 통증이.
We see now the quadratus lumborum, and by bending to the left side, it will give a stretch of the muscle and the trigger. If you now bend to the right side, the muscle is not stretched, but it has very little space, and it's possible that it is pushed by the transverse process by TP. Yeah? So this can happen. It can also be a sign for sure for a joint problem, a facet problem. This we have to know. It can be both, but it can also see a problem for the muscle. And simplest way to differentiate is to make a preparatory treatment of the facet joint and make retest, or a preparatory treatment of the muscle of the quadratus lumborum and make a retest, and then you get the information. But we will see. So please lie on your left side. This is your jacket. This is
이
great.
상황에서 여기 만약에 오른쪽으로 구부렸을 때 여기 공간이 좁아지면서 TP가 이제 TP으로서 통증이 일어날 수가 있다고 했습니다. 그런 경우에는 이게 이제 어떤 확세 조인트의 문제인지 먼저 확인하기 위해서 우리가 저번에 목에서도 했었던 것처럼 조인트에 대한 치료법을 적용을 간단하게 하고 다시 리테스트를 했을 때 반응에 따라서 우리가 감별을 할 수가 있다는 설명이었습니다.
Often we use a pillow here because then the lumbar spine is curved a little bit and it's more open between here the crest of the spina and the 12th rib. You see there is not a lot of space, and with this pillow I can open it a little bit more. So a little bit of massage milk, please. I don't have my copy here. Thank you. So first, identification of these reference points. I am looking here for the crest, iliac crest. I am looking for the 12th rib. And then I start with palpating in front of the muscle. I'm at the crest, and then I go back and I feel here. I can't enter anymore as far in front. Here I can show it again. With the paper, the model is there. Here. You see the muscle runs like this. And first I am looking here and here, then I have the orientation. As next, I start to palpate not here, I start to palpate here. Why? Here I can enter forward, and if I reach this point, I can't anymore go forward, and then you know exactly where is the border of the quadratus lumborum. So I start here laterally, I go medially, and I feel, oh, I can't go anymore anteriorly, and then I know here I have the border of the quadratus lumborum, and then I follow the border of the quadratus lumborum.
네, 저기서 일단은 베개 까는 이유는 저희 공간을 좀 더 열어서 통제하기 쉽게 하기 위함이고요. 이 상태에서 바로 근육으로 들어가는 게 아니고요. 일렬 했을 때 앞쪽에서부터 시작을 하는 이유가 여기는 근육이 없지만은 여기 앞쪽에서부터 시작하다 보면은 갑자기 내 손가락이 더 이상 안 들어가는 그런 상대적인 어떤 팔페이션이 좀 더 깊이 들어가기 힘든 부위가 있습니다. 여기가 이제 quadratus lumborum 시작하는 부위라고 생각을 하면 됩니다.
But the direction is not like this, it's really like this. This is important, otherwise it doesn't.
그리고 중요한 점은 이렇게 방금 손가락처럼
Yes.
요렇게 누르는 게 중요하다고 합니다. 손가락 방향, 요 형태로 이렇게 들어가는 게 아니고 요렇게.
Yes. For the identification, I make it like this. I show it here. I have here the crest, and you see I go in this direction forward, and now here I can reach very far. And I go back and I feel, oh, I can't reach anymore because it's a limitation, and this limitation is the quadratus lumborum itself. So I have identified the border of this quadratus lumborum. Then I follow the border of the quadratus lumborum. It's okay? Okay. And then I go on the quadratus lumborum. Okay. And then I look for sites which are painful. It's okay? Does it hurt?
Little pain.
A little pain. You know this pain or not?
No.
No. How is it here? You know the pain or not?
비슷한 것 같은데.
Huh? Can you translate?
It's similar.
Similar. Okay. And how is it here? Similar or not?
Okay.
Not here?
Oh.
Yes?
Yes.
Okay. And you see, it's very little space, 1-2 millimeters. Here the pain is known, here it is not known. And this is a very good sign, because this means it's not a generalized problem, it's a very specific local problem, as we described with trigger points, a local area, not all the muscles, not whole the area. It's just a little point in this whole area. Translation?
네, 그래서 아까 봤듯이 되게 선생님이 조금 이렇게 움직였는데 그때마다 통증 양상이 변한다는 거는 우리 실습자 굉장히 좋은 신호인데 우리가 방금 배웠듯이 굉장히 국소적인 통증이 나타날 수 있는 근육이라고 배웠습니다. 그래서 이게 해당되는 신호라고 생각할 수도 있는 가능성이 있는 겁니다.
And you see the quadratus lumborum runs laterally from the PT. He doesn't go to here, he just goes to the transverse process. So it's no conflict with the erector trulci. The erector trulci lies medially, and I can push it a little bit by side, but the quadratus lumborum, he stops here. Okay. So
네, 그리고 또 하나 신경 쓸 점은 이 SP와 TP 사이에서는 에렉토가 지나가는 공간이고 그래서 우리는 TP부터 이렇게 구역을 명확하게 해서 눌러야 된다고 했습니다. 저것처럼.
exactly. So here I have the lateral border of the quadratus lumborum. Then I'm on the quadratus lumborum, and you see here is the erector spinae. But this is no problem because the erector spinae runs between the SP and ST and the PT, and so it's not a conflict. The longissimus and iliocostalis don't cover the quadratus lumborum, because in Europe many people think that there would be a conflict, but there is no conflict at all. I can reach it at the quadratus lumborum, and I can make confrontation, provocation. I'm looking for the most painful spot. And you see in this dorsal part of the muscle, it's less reaction. Then I go back to this region here, and you see the sign. This is international. This I understand very well. You know this pain?
Yes.
Okay. And then is the moment to treat.
자, 그래서 저기서 했던 내용을 한 번 더 강조를 했고요. 그래서 표현 같은 경우에는 이제 에렉토 같은 머슬들에서 커버가 되지 않는 위치에 있기 때문에 두 개를 구분하는 것은 크게 어렵지는 않고요. 그리고 선생님이 한 번 더 살펴 프로모팅 테스트를 하기 위해서 이 경계면에 있는 등 쪽에 있는 부분을 눌렀지만은 그렇게 뭐 아파 보이거나 사인을 주거나 하지는 않아서 지금 다시 아까 통증이 발현됐던 부위로 갔습니다. 그리고 이제 찾았으니까 치료할 시간이라고 말을 하셨고요.
And which technique I performed during the translation?
지금 어떤 테크닉?
Which technique I performed?
지금 대표님 뭐죠?
Technique 1. I whole time I used for treatment, so I practiced technique 1. Now I change to technique 2A. It's okay? It's too much?
Oh, okay.
It's okay. Great. I can perform it like this. Or most often I practice like this. Please make this leg straight. The knee rests like this, and then you go in this direction with the whole foot, yes, and you come back and you go long and back. Perfect. You continue. Does it hurt? I don't hope, because it's just the introduction. Then you stop. I go on the point. It's enough. You feel your pain?
Pain.
Okay. And now you make this movement. You go along and back.
근데
And up.
이렇게
Yeah,
하면
yeah. Now it's very, very heavy.
왼쪽이 더 아픈데.
왼쪽?
왼쪽이 아픈데.
왼쪽
She
어디가?
got a pain when you move.
Yeah, yeah.
Oh.
When she moves, this I know.
She got a left.
But you
left
see-
side, left
She
side,
felt
left
the
side.
pain in
at
the
the
left
left
side
side.
when she moved.
Okay. Once again, please move. You feel it on the left side?
이렇게 내릴 때
When she make the leg go down.
그래서
Okay.
아파.
So she has on both sides a problem, the quadratus, because the left quadratus lumborum makes the movement when she pushes with the right side. So this, please push as far that you don't feel the pain.
통증이 안 느껴지는 선안에서 제일 멀리 보내보십시오.
Can you make the movement a little that you don't feel on the left side? Yes, great. It's okay? And now you rest in this position, and the muscle is pre-stretched, and I go on the muscle, pre-stretched.
그래서 지금 다리를 뉴트럴보다 조금 내린 상태라서 프리스트레칭이 된 상태에서 프레스를 누르고 있습니다.
And now you make a little movement, yes, that you don't feel on the left side, just on the right side.
지금 왼쪽에 느껴지는
Perfect, yes.
a little bit in left side.
So you go make smaller the movement.
조금 더 작은 움직임으로, 작은
Yes,
움직임으로.
perfect. Left side okay?
Okay.
Great. Now you rest in the position
유지.
that it doesn't hurt left, but you are along. You rest here, and I perform a technique 3 in pre-stretched quadratus lumborum. Very efficient.
그래서 통증이 느껴지지 않는 선 안에서 프리스트레칭을 유지한 상태에서 테크닉 3를 적용을 하고 있습니다.
Is it okay?
괜찮아요?
You see very slow in pre-stretched position.
굉장히 천천히
From one side to the other.
한쪽으로 갔다가 반대쪽으로
From this side to the other. It's okay? Great. And now, something friendly. You release. Now, calm down. It's okay. Okay. Retest.
다시 재검사를 해보겠습니다. 그러니까 왼쪽에 아까 선생님 우리가 검사할 때 왼쪽에도 소비를 문제로 가능성이 있었기 때문이라고 합니다.
This. Like this. You go to the left side. It's equal, more, less.
오른쪽.
오른쪽은 이제 괜찮은 것 같아요.
Now it's okay on the right side.
왼쪽.
Just silence.
So you have a reason for an extra trick.
쌤, 오른쪽 할 때 오른쪽이 아팠었잖아요.
Once again on the right
그래서
side.
오른쪽에서도 괜찮았어.
And if you go now on the right side,
오른쪽에 있을 때 오른쪽이
does it
괜찮아요?
hurt?
지금 이렇게 했을 때
이제 왼쪽으로.
둘 다 괜찮은데 지금 왼쪽만 많이 쪽이 더 아파서
If you go on the right side, does it hurt now? It's getting better. So you see, probably it's not the facet joint because we didn't treat it. So please explore it. Okay, quadratus lumborum. First, please make this test. And then, if you have difference, you treat this side and you can make a retest. If there is no difference, you just make a treatment of the quadratus lumborum on one side. Yes, thank you so much.
자, 지금